Oral questions by members.
Leader of the Official Opposition.
Thank you, Mr. Speaker. Another day of carnage in communities as a direct result of this Premier's legalization of the open use of crack cocaine, meth and fentanyl in our parks, playgrounds, beaches and even hospitals. Not only has the federal government not granted the Premier's request for partial decriminalization, but frontline police are now calling for this disastrous decriminalization experiment to be completely scrapped. Jeff Swan from the National Police Federation warns, and I quote, "Just making a modification to this policy will not work. It needs to be collapsed to protect the public, to protect neighborhoods and police officers across the province." End of quote. So will the Premier finally listen to our frontline police and adopt BC United's bill introduced yesterday to scrap his failed decriminalization policy entirely? And if not, why not?
Minister of Public Safety and Solicitor General.
Thank you, Honourable Chair, and I appreciate the question from the member. As I would remind the member, this is a health issue. It's not a criminal issue. This morning, the Chief of Police of the City of Victoria said that the changes that were introduced on Friday were very important in terms of dealing with the challenges that his officers are facing on a day-to-day basis. The changes were made by consulting and working with police to ensure that they have the tools that they need to deal with open drug use, Honourable Speaker. Those are the issues that have been identified by the public, by communities. That's why we put in place Bill 34 that's before the courts. But the fact that that is taking far too long in order for us to deal with those concerns is why those changes are made. We are giving police the tools that they have asked for to keep communities and the public safe.
Leader of the Official Opposition Supplemental.
Thank you, Mr. Speaker. Well, I have news for the Solicitor General. No changes have been made. There has not been any change made whatsoever except for this Premier and this floundering government sending a letter to the federal government saying, please bail us out of our own stupid decriminalization experiment. That's the only thing that's happened. This Premier's decrim deception has not ended the crime, the chaos, and the social disorder that his radical policies have caused. Frontline officers and the police union say only a total repeal of this disastrous policy will stop the ongoing daily carnage, and that the damage control from this Premier will only make things worse. The union warns, and I quote, "Police officers are going to be left facing increased criticism, and citizens are going to become more frustrated with this failed policy." End of quote. So again, to the Premier, when will this soft-on-crime Premier finally listen to frontline police and adopt BC United's bill introduced yesterday to end this failed decriminalization experiment?
Solicitor General.
Thank you, Honourable Chair, or Honourable Speaker. Again, I appreciate the question from the member. When it comes to deception, Honourable Speaker, really the only deception been going on is the positions that have been taken by the opposition. You know, when you have the leader of the opposition standing up and saying that some of the chiefs of police were supportive of decriminalization and what they were supportive of is not charging people for small amounts of drugs, I agree with that, Honourable Speaker. Those are the words of the leader of the opposition. When other members of the opposition are saying, does it mean that our party doesn't support decrim or harm reduction? Absolutely not. We do with our whole hearts, Honourable Speaker. We want to save people, Honourable Speaker. That's been their position. It changes when, you know, as I like to remind the members of the House that the two members down there change their position, so do the opposition. The reality is this, Honourable Speaker. We work with police on a day-to-day basis to make sure that they've got the tools that they need. This is a health issue, not a criminal issue. This is about dealing with open public drug use of illegal substances. That's the changes that we have been putting in place. That's the changes we are working with Ottawa on. We know, Honourable Speaker, that people are concerned about public drug use and it taking place in the open. But we also know that people are concerned about those who use in the privacy of their own home, Honourable Speaker. And those members over there know that too often those are people who work on our resource projects, that work on our pipelines, that work in the forest industry, that the organizations that represent them have been concerned about their getting them the treatment that they need. The work that we are doing ensures that that can be done, that they do not have to worry about being arrested, Honourable Speaker, or criminalised.
Member for Skeena.
Mr. Speaker, the NDP Premier's decriminalization policy has not only normalized drug use, but also introduced so-called safe supply drugs into our communities, where they are addicting our youth. This week, a doctor reported a devastating 22% increase in youth deaths involving these government-supplied drugs. Our First Nations communities are suffering every day under this policy. My question is to the Premier. How much longer must First Nations suffer under this Premier's dangerous experiments with our kids' lives?
Minister of Mental Health and Addictions.
Thank you very much, Honourable Speaker, and thank you to the member for raising what I know is a very important issue for every single member of, in this House and across British Columbia, and that is the safety and the health and well-being of children and youth in our communities. And I want communities and British Columbians to rest assured that the primary work of our government is to make the investments and the supports that children and youth need. We are working upstream. We've increased Foundry centres. We've just made an announcement last week about a significant expansion to integrated child and youth teams working out of our schools and with our child and youth mental health system. We are thankfully not seeing, according to McCreary, a report that came out recently, an increase in youth being sort of attracted to opioids. It's why we're running a campaign, a social media campaign, to talk to youth directly about the dangers of the illicit drug supply. We really, really want youth and their families to know how dangerous the illicit drug supply is right now. We're going to continue to do that work. We know how important it is to be reaching to youth.
Member for Skeena Supplemental.
Mr. Speaker, everybody in this place knows that our Indigenous communities are disproportionately suffering in this drug crisis. It is killing Aboriginal youth at a rate 6 times higher than the provincial average. And it's made worse by NDP government policies that create more addiction.
Member will continue.
He's getting heckled.
Member will continue.
Are you serious?
Members.
What about down there?
Members, please. Member has the floor. Please continue.
Thank you, Mr. Speaker. And it's made worse by NDP government policies that create more addiction. 2 months ago, police seized 3,500 hydromorphone pills in a First Nations community of only 600 people. 2 years after the start of the so-called Safe Supply program, youth deaths involving these government drugs increased by 22%. When will the Premier end his disastrous policies of decriminalization and of so-called safe government-supplied drugs?
Minister.
Thank you very much, Honourable Speaker. And I think it's important to note that what is devastating communities is an illicit drug supply that has concentrations of fentanyl that are off the charts, that has contaminants that do terrible things to people's bodies. And indeed, there is no question that vulnerable populations are disproportionately impacted by this crisis. Honourable Speaker, that's why we're working directly with First Nations directly with provincial leaders, with the First Nations Health Authority, to stand up services dedicated to Indigenous youth. We just supported the opening of Orca Lalem in Lanceville a couple of weeks ago, which is a first of its kind facility in British Columbia dedicated to caring for Indigenous youth. We have a $171 million investment in working with nations to stand up Indigenous-led treatment and recovery. That's the work that is so important for us to do in communities on the ground and in partnership.
House Leader of Third Party.
Thank you, Mr. Speaker. Relying on agency nursing, private nursing agencies is costing British Columbians and contributing to worsening health outcomes. Spending on agency nursing has steadily increased. 2018, 8.7 million, 2019, 19.9 million. In 2029, that ballooned to $64 million, Mr. Speaker. Those agencies charge a premium and pocket the profit. Meanwhile, the nurses they work alongside are working for lower pay and increasingly unsafe working conditions. Why are the BC taxpayers paying for corporate profits in nursing in the public health care setting? It's unnecessary and leads to worse health outcomes. We need to break this unsustainable cycle. We need to improve conditions for public nurses, and we need public money to support frontline healthcare workers instead of corporate profits. My question is to the Minister of Health. Will he commit to ending reliance on agency nurses in British Columbia?
Minister of Health.
Well, thank you very much, Honourable Speaker. More than a year ago now, we froze our agency nursing contracts. We're currently renegotiating those contracts. We'll have new contracts in place on May 31st, which will have very significant limits on agency nurses. That said, when we need nurses in the community, and we've had this discussion the last few days, we take steps to get nurses in the community. But what have we done? We've brought in a world-leading nurse ratio program with the BCNU to recruit and make this the best place in the world to be a nurse. We've dramatically increased the number of nursing spaces across British Columbia, 604 spaces. We had a record year of new nurses in BC last year. We're continuing, Honourable Speaker, at every level, internationally educated nurses, a 50% increase in the employed student nursing program. In short, Honourable Speaker, we are doing the work necessary to recruit, retain, and attract new nurses in BC. That's critical work for our healthcare system. We're continuing to do that because, and the key part of our work with the BCNU was to address this very issue of agency nursing, to do it together by making this a better place to be a nurse and making it a better deal to be a nurse in the public healthcare system.
Member supplemental.
Thank the Minister for the response. While our failing healthcare system is increasingly propped up by more expensive agency nurses, and we just heard the Minister's moving away from them, student nurses are struggling. Student nurses work hundreds of hours in unpaid practicums through the employed student nursing program. They have to pay to work, they have to pay for parking if they can find it at all, and they have to pay for application and licensing fees. Why is anybody paying for parking at hospitals? Anyway, when those nursing students graduate, they're often deployed into units with the highest staffing challenges and thrown into incredibly challenging conditions. And despite instructions to health authorities to implement greater restrictions for the new grad program, my question again is to the Minister of Health. Beyond student loan forgiveness, how is the Minister compensating student nurses for the hundreds of free hours that they're serving our communities?
Minister of Health.
Honourable Speaker, we had this discussion in estimates. We go through the very significant supports we're putting in place for student nurses, including new seats and other supports. One of the main ways we're doing that, though, is dramatically increasing the employed student nursing program, which is absolutely a paid program. 1,300 to 2,000 spaces, and they are full. And that is part of a continuing effort, Honourable Speaker, to support nursing in our province, to support nurses in our province. When you ask what are we doing for student nurses, that's exactly what we should be doing, which is significantly expanding opportunities through the employed student nursing program to do that. And that was part of work we did with the BC Nurses Union, with the Nursing Bargaining Association, and with the community of nurses in BC, including the universities. I think it's an important step worthy of support by everybody in the House.
House Leader of the Fourth Party.
Thank you very much, Mr. Speaker. Mr. Speaker, the BC's Coroner's Report reveals that since the introduction of Safe Supply, 11 children, 11, have died from overdoses in British Columbia. That's 11 families that have lost a daughter or a son. 11 sets of parents, 22 sets of grandparents who are left twisting in the wind, wondering why their government used their own tax money to subsidize powerful recreational drugs that killed their children. The death of each of these children has created a hole in a mother's heart that will never be filled. My question to this ND Premier through you, Mr. Speaker, how many more children need to die before this Premier admits that a safe supply is not safe, it's killing children, and it must be repealed?
Minister of Mental Health and Addictions.
Thank you very much, Honourable Speaker, and thank you to the member for raising what is a very serious and distressing issue, which I know all members of this House feel deeply and strongly about as advocates for their communities, and just want to express our collective grief and compassion to families who are dealing with the loss of loved ones. Honourable Speaker, I talk to a lot of parents. I talk to a lot of family members who have lost people in their families and in their circles to the toxic drug crisis. And the extreme toxicity of the illicit drug supply, the concentrations of synthetic opioids like fentanyl that are off the charts, the perverse contaminants that are in the illicit drug supply are indeed very dangerous to our communities. I mean, this is why we do the work that we do with our health system, with all of our partners, to turn the dial on this crisis. There is nothing more important than ensuring that our kids are safe. That's why we're doing the work with schools, with our health system, to make sure that kids have access to the supports that they need.
Member Supplemental.
Mr. Speaker, 7 people are dying in British Columbia every single day from drug overdoses. This NDP government's pro-drug use policies, both safe supply and decriminalization, has killed thousands of British Columbians since it was introduced by this NDP Premier. Instead of trying to get people well, Mr. Speaker, the NDP is opening taxpayer-funded drug use sites in family neighbourhoods like the one that was proposed in Richmond. These sites, where people are using drugs like fentanyl, which causes permanent brain damage, people who use these drugs regularly can never truly recover. My question to this NDP Premier through you, Mr. Speaker, how many treatment beds could have been paid for with taxpayer money that was used to buy safe supply drugs that killed BC children? How many people could we have otherwise saved with the money that was used to buy drugs that killed British Columbians?
Minister of Mental Health and Addictions.
Thank you, Honourable Speaker. And just to be very clear about the nature of this crisis, Honourable Speaker, it is the toxic illicit drug supply that is killing British Columbians, that is killing Canadians right across the country. We are not the only jurisdiction, we are not the only province that is experiencing the scourge of an illicit of a toxic drug crisis. They are experiencing it next door in Alberta, where they saw a 17% increase in mortality last year, over a 20% increase in Saskatchewan. Honourable Speaker, this is a serious public health emergency. It is a very serious issue. And we are going to continue to work across the continuum to keep people alive so that we can connect them to the care and supports that they need. I have to say, Honourable Speaker, that overdose prevention sites have saved in excess of 8,000 lives in British Columbia, and every single... And I think British Columbians think, and I think the loved ones of those individuals think that it was very much worth saving each and every one of those lives. Our government is committed to doing everything that we can to ensure that we protect our communities, protect people, provide them access to the care that they need, and that we keep them alive to connect them to care. 8,000 lives that were worth saving, Honourable Speaker.
Member for Parksville, Qualicum.
For British Columbia's oldest residents, the #1 cause of premature death by far is heart disease. And yet in our community, with the oldest population in the country, we still have no heart catheterization facilities at the Nanaimo Regional General Hospital. It's the only community of our size that doesn't have this critical health facility. This is about priorities. South of the Malahat, there are 22 cardiologists, where north of the Malahat, we have 2. Government is funding 2 new heart cath labs in Surrey, but for our community, we have none. This is a government that is prioritizing a $600 million sporting event over the health and the wellness of people who live north of the Malahat. The Health Minister has a plan to help patients that need cancer care in our region. He has already delivered results for patients needing intensive care, but he has no plan for patients to deliver better health care for heart care. To the Minister who is avoiding the question about heart catheterization facilities in Nanaimo, what is his plan to deliver better heart health care for the people of my community?
Minister of Health.
Well, the member will know that there are a few communities in Canada that are receiving and will be receiving the level of capital investment that we're delivering to Nanaimo for critical priorities, and the member talked about that. Cancer was a generational priority in Nanaimo. We're building a new cancer center. The ICU is really a generational fight by the whole community, the ICU and the HAU. He knows significantly with respect to long-term care, the gap that exists and why we're doing it. He was part of our discussions on that very project at a previous time. With respect to cardiac care, there is a significant provincial recruitment program in place to support Nanaimo Regional General Hospital deliver the care now. Clearly, Nanaimo is going to need more investment over time, and we absolutely intend to provide it. And when we talked about cardiac catheterization, I don't know when he says there's no community this size. There are 5 sites in the entire province now, 5, not 50, 5. And we are expanding that to Surrey, and that's the right decision for that community given the growing size of that population and the needs of that population. And we are going to continue to work to improve cardiac care in Nanaimo. And it is a critical priority for Island Health, a critical priority for the Provincial Health Services Authority, and that is to ensure that there are adequate staff to support patients that need care at Nanaimo Regional General Hospital.
Parksville, Qualicum, supplemental.
Thank you, Chair. The challenge in staffing a heart cardiology department at NRGH is without the facilities, it's very difficult to keep the staff, and that's why we've seen the constant churn of staff there. North of the Malahat, we have 450,000 residents that don't have direct access to heart catheterization facilities. In 2006, a review by the Ottawa Health Institute found that 1 out of every 30 patients at that hospital died unnecessarily, requiring heart care. In 2010, Island Health report identified the need for dedicated cardiac unit, and the local government has committed hundreds of millions of dollars to make this happen. The clinical benchmark for care is 90 minutes. And yet I'm repeatedly hearing from patients that are getting 6, 7, 8 hours before receiving care, some of them even being turned away from the hospital. The question again is, what is the plan for NRGH heart facilities?
Minister of Health.
The plan is to significantly improve care and services in Nanaimo. The plan is to have, as part of our provincial health human resources plan, to have more doctors. We're doing that in the community. More nurses. We're doing that in the community. More health sciences professionals. Critically important to that is the work of perfusionists. We addressed that issue with specific action yesterday, Honourable Speaker. So all of those actions, Honourable Speaker, are part of the effort to ensure that people in Nanaimo get the cardiac care they need and deserve. We are investing in Nanaimo, and we will be investing more.
Opposition House Leader.
Well, Mr. Speaker, under this NDP Premier, healthcare in British Columbia has hit rock bottom. Illicit drug use, drug trafficking, and violence are rampant within our hospitals across this province. Emergency rooms, when they're not closed, are overcrowded. We have cancer patients being shipped to private hospitals in the United States because they can't get the cancer care that they need right here in British Columbia. Now, the official NDP response to rampant meth smoking in hospitals was, it's no big deal, just a poorly worded memo. Of course, the official NDP response just days ago to cockroaches crawling on walls and on linens, and yes, on patients in the Saanich Hospital, don't worry, they're German cockroaches and they don't bite. As if the breed of cockroach makes infestations in British Columbia's hospitals any less disturbing. This is the result of 7 years of disastrous NDP healthcare mismanagement. Mr. Speaker, when is this Premier going to do the right thing and fire this incompetent health minister?
Minister of Health. Minister of Health.
Honourable Speaker, I just want to say I know that when members of the opposition put forward inaccurate information, sometimes you're advised to just move on and focus on other things. What happened in Saanich Hospital, and the Leader of the Opposition was Minister of Health, he knows that from time to time there were infestations in his time. I could review all of those. I don't think I will, Honourable Speaker. I'll say what happened at Saanich Hospital on April 17th was an infestation was discovered, and it was immediately responded to by pest control, and that's what you would do in any circumstances. That's the protocol, and that's what you do, Honourable Speaker. With respect, Honourable Speaker, to nursing, for example, what we've done in British Columbia is put up into it, and I think you saw, if you were being briefed by the BCNU this week, that ratios save lives.
Member
Well, Honourable
for Surrey
Speaker,
South.
we are leading the world in the development of nurse ratios in BC. And that contrasts, and Honourable Speaker, that contrasts because, Honourable Speaker, our record is leading Canada in recruiting new nurses. That's our record, Honourable.
Members, Minister of Health has the floor, please. Member. Minister.
Thank you, Honourable Speaker. With respect to nursing, Honourable Speaker, we've led Canada in the recruitment of new registered nurses since I've been Minister of Health. And we are continuing to engage in that work, Honourable Speaker, with a record year last year. And this contrasts, Honourable Speaker, and the Opposition Health Leader may not have been there, I don't know. 2009, Minister of Health was Leader of the Opposition, 42,122 registered nurses. By 2011, when he left, it was 40,149. The only time in BC history where we lost nurses, and it was the same for registered psychiatric nurses, Honourable Speaker. There was a net loss in nurses. There's an actual numerical loss in licensed practicing nurses. A generation of, frankly, lost, Honourable Speaker. And so, Honourable Speaker, we are going to continue our efforts to recruit doctors, to add nurses, and to add healthcare workers across British Columbia.
Member for Vancouver-Langara. Member for Vancouver-Langara has the floor.
Mr. Speaker. There is a very disturbing pattern of hate against Jewish students in our universities, as anti-Semitic encampments have spread from UBC to the University of Victoria to Vancouver Island University in Nanaimo. Charlotte Cates, arrested for hate speech that praised the October 7th massacre of Jews by Hamas, is supporting these encampments on behalf of Samidoun. Samidoun has received government funding, but has strong connections to the Popular Front for the Liberation of Palestine, the PFLP, a listed terrorist entity in Canada. And while McGill University has requested police assistance to protect student safety, this Premier has done nothing to keep students safe. Given the spread of anti-Semitic encampments across British Columbia, why has there been no action similar to that taken in other provinces to protect students from radical activists who openly praise Hamas?
Minister of Post-Secondary Education.
Thank you, Speaker. And I want to be very clear for the member and everyone listening that celebrating murder and sexual violence is completely unacceptable. And it's extremely disappointing to see individuals use such tragedies as this to promote hate. University campuses have historically been places of free speech, and they continue to be so. Places where people can freely debate ideas. Now, that being said, Honourable Speaker, campuses also have to be places of safety for all students, faculty, and staff, including Jewish faculty, students, and staff. Our government and all the post-secondary universities and colleges across the province.
Member, please let her answer the question.
Thank
Minister
you,
will
Speaker.
continue.
This is a very important question. I want to give a very important message to the opposition who asked the question, because hate of any kind is not tolerated on campuses. Hate of any kind is not tolerated by our government.
Members, it's not necessary to comment on every step of the way. It's okay. We are almost done. Minister will conclude.
Thank you, Speaker. Universities, colleges, and institutes across the province do have the policies and tools in place to allow for a peaceful protest while also ensuring everyone on campus is safe, and I expect all the institutes to find that balance. Thank you.
The bell ends the question period.